All right, let's dive into something pretty fascinating. The descending TMJ and the body's hidden connections. We're going to unpack this idea that one tiny joint could be the secret source of problems, well, all over your body. Let's get started.
So let me ask you this. Could your chronic headaches and that nagging foot pain actually be connected? I know it sounds a little out there, right? I mean, you go get treatment for your neck, for your back, maybe your knee. But what if the real problem, the actual culprit, is hiding somewhere you'd never think to look? What if all these things you thought were separate are, well, what if they're not separate at all?
Well, it turns out the answer might be hiding in a really surprising place. And today, we're going to follow the clues, kind of like detectives, to see if we can find a root cause that literally connects the top of your head all the way down to the soles of your feet.
Okay, so where does our investigation lead us? Well, we're zeroing in on one primary suspect, your jaw. And more specifically, we're talking about the temporomandibular joint, or TMJ.
So what is the TMJ? Well, it's this incredibly complex hinge that connects your jaw to your skull, right there in front of your ears. And it's not just a simple hinge, It's what lets you chew, talk, yawn. It does a ton of work. And because it's so active and so complex, it can also be a spot where things, well, where they start to go wrong.
And here we go. This diagram gives us our first real look at the evidence. What you're seeing is a map of something called a descending TMJ. Basically, it shows how a problem that starts right here, in the jaw, can create this massive cascade of issues all the way down the body. Really, the best way to think about it is like a domino effect. Seriously, a tiny little push on that first domino, which in our case is a misaligned jaw, can set off a chain reaction that just keeps going and going, way farther than you'd ever imagine. So let's do that. Let's trace this domino effect. We're going to follow the pathways and see exactly how one joint can impact the entire body. Okay, first up, let's look at the vagus nerve. This is a super important nerve. It basically wanders all the way from your brainstem, down your neck, and into your chest and stomach. Now, if your jaw is out of alignment, it can create tension that messes with this nerve, and that can lead to things like stomach reflux or even weird breathing patterns. All right, next connection, the brachial plexus. This is a whole network of nerves that goes from your neck right down into your arm. And just look how close it is to the jaw and the skull. It's not hard to see how any pressure or misalignment right there could just radiate outwards, causing shoulder pain, arm pain, maybe even that pins and needles feeling in your fingers.
And then there's the third connection, the structural line. This shows how your whole posture can be affected. Think about it. A misaligned jaw can actually tilt your head. And when your head tilts, your shoulders and hips have to compensate to keep you balanced. This whole